Hello all. Good evening. Welcome to all to join this session. His voice is clear and his PPT is visible so that I can proceed further. Yes. Thank you. So let's start today's session. So today's session is on rainy weather on monsoon season. How we can help the patients in this rainy weather or in this monsoon season with our homeopathic remedies. In which conditions we should prescribe what remedy based on symptoms. So we will be entering into this session with lot of rubrics and materiamedica as well with their clinical indications. So before entering into homeopathic point of view, first we'll understand what are the common monsoon diseases that many people suffer due to this rainy or this wet, damp weather. One is diarrhea, viral fever, malaria, dengue, influenza, stomach flu, leptospirosis, chikungunya, cholera, and typhoid. So these are some common monsoon diseases where many people suffer due to this monsoon season. So in these particular pathological conditions, what could be our approach? How we can approach in such diseases and help the patient through the symptomal treatment? How we can help? That is what our session is mainly based on. So let's come into this rubrics pattern of mind chapter, right? So first rubric of this today's session is mind discontent, weather, rainy weather during. The remedy is aloes. Only single remedy, that is aloes. So this rubric tells you the meaning of the patient is so much discontent due to this weather and rainy weather conditions, or you can say the wet damp weather. So the patient come to you and tells doctor, due to this weather, now due to this regular rain which is coming from first 1 day, 2 day, 3 day continuous rain, now I am so much of discontent feeling. So at the time think of aloes with indications. So what are the main indications of aloes to prescribe? And what are the cross reference you need to ask for a aloes patient? Is his aloes and how to confirm? So it is a remedy to aid in re-establishing physiological equilibrium after much dosing where disease and drug symptoms are much mixed. So, right, we normally think of Naxomica, right? When there is much overdosing of allopathic medicines to antidote that, either we think of Naxomica or camphor. But aloes is also a remedy where we can re-establish the physiological equilibrium after much dosing and which comes very close to sulfur. The chronic is sulfur. This is acute. So sulfur also helps in that much after dosing of allopathic medicines where the drug symptoms are much mixed. And one of the key confirmatory of aloes is bad effects from sedentary life or habits. So we normally think of Naxomica, right? So whenever patient says, doctor, I don't have any job. Now I am a very retired person. So due to this sedentary life and these habits, now everything has started. I feel very much discontented. I feel back pain. I feel headache. And I developed these piles also in recent year after my retirement. Can be aloes. Bad effects from sedentary life or habits. So whenever patient comes and tells you such a symptom, there is one rubric from synthesis, that is generals, indolence and luxurious elements from. The remedies are Allium sativum, Carbovage, Climatrix, Digitalis, Helonius and Nux vomica. So you add this rubric, and from this rubric, you just cross-reference the patient based on the remedies and the confirmatory symptoms. This rubric will give you a lot of information whose patients have this sedentary life habits. From there, everything has started. That is the main cause. I can say that is the exciting cause for a patient or the fundamental cause in a chronic patients who have this sedentary life habits. This is the rubric. So coming to next rubric here, mind irritability weather in rainy or cloudy. The remedies are aloes, ammonium carb, dalcamera, and ruta. So whenever this rainy season starts now, the patient gets irritability. How a patient expresses this symptom, right? Patient says same version what I prescribed before. Due to this rainy weather, I am feeling so much of irritability, doctor. So much of irritability. I am getting so much of irritability because my clothes are not at all dry. Whenever I go out, I am coming with wet clothes. I am very much irritability due to this weather. I doesn't like this weather at all. I feel very much irritability. This is the rubric. And in that, the remedies are aloes, ammonium carb, dalcamera, and ruta. There is another rubric here, mind, mores, weather, rainy from ammonium carb. This ammonium carb is the remedy where in materiamedica it is written stormy rain, very much windy stormy rains, where you can see this type of stormy and windy rains near to Mumbai or northern parts of India, where there is so much of wind with lot of rains. So at that time, this ammonium carb comes into your rescue when patient is so much of irritability with ammonium carb like indications. So followed with some clinical tip here. Cough following influenza. When bryonia does not work, think of ammonium carb. In influenza, when they develop cough, but bryonia is not working or gelsemium is not working, that is bad elements from influenza, think of ammonium carb. Ammonium carb is one of the remedy where you can think in snuffles in children, comes very close to Sambucus nigra. Even Sambucus nigra has this symptom that is snuffle in children with infants, where patient or the mother of the child says, doctor, now my beta is not able to breathe at all at night, complete nose obstruction. He breathes with mouth at all. At that time, you can think of ammonium carb and Sambucus nigra. And another key informatory of ammonium carb is all ammonium carb patients are obesity. There is one rubric in synthesis that is general sedentary habits in obese, only two remedies, that is ammonium carb and cocculus. These two remedies with obesity, with heart symptoms, with sedentary life, think of ammonium carb. Is it clear? Everything is going well and audio PPT is visible? Thank you. So coming to next set of symptoms, the rubrics pattern. Depression with rheumatic symptoms when rainy aggravation. The remedy is phytoleca. Here you see, the two rubrics. One is a broad mind symptom, another one is a broad pathological symptom, right? So here you see the depression and rheumatic symptoms. So whenever you get a case of anything which is very pathological, and always confirm with a mental state. The main question you need to ask is there, during these pathological conditions or during these sufferings, how is your mental state disturbed from your normal life? So that will give you some indication, and that can be leading to a remedies like phytoleca. There are many other remedies which is interlinked with the one broad mind symptom and one broad pathological symptom. So to learn such broad mind symptom and on a broad pathological symptom, always refer nerve repertory. In nerve repertory, he mentions such type of rubrics very clearly. So here you can see depression with rheumatic symptoms and with rainy aggravation. The remedy is phytoleca. And in rheumatic symptoms, the main sensation or the type of pain in phytoleca is electric leg pains. That is the key indication of phytoleca. Coming to next rubric, mind, fear of rains. The remedies are calcarea carb, calcarea pos, elapse, and naja. Interestingly, in fear of rains, there comes always a role of snake remedies. Why? Because snake lives under the earth, right? So they have a fear that if this rain is very heavy, my child X can destroy. That is the main fear of snake remedies. So that is the main reason behind this rubric. Why mind fear of snakes? There are fear of rains. There are two snake remedies in that. That is elapse and naja. Under one calcarea and calcarea pos. Calcarea develops this fear of rains due to insecurity and the protection, which is from oyster of shell. That is the main theme or core of calcarea carp. Right. Next rubric. Mind indolence, aversion to work, weather, damp, wet, aggravation. The remedy is sanguinaria. Here you see, many patients will tell, na, doctor, due to this rainy weather, na, I am not able to concentrate on my work. I feel very lazy, very dullness. Na, I don't like this weather only. Due to this weather, na, 1 week I did not went to office. I have no mood of going to office at all. That is sanguinaria canadensis. That is the rubric. Mind indolence, aversion to work with damp weather aggravation. The only remedy is sancan. So here ends some mind rubrics. Now we will go into the pathological rubrics with the rainy, damp weather aggravations. Coming to head chapter. Head eruptions, itching, whether in damp, wet, rainy. So due to this damp, wet, rainy, patient complains of head eruptions with lot of itching. The two remedies comes to your rescue is macab and sorinum. Now, how you can differentiate this macab and sorinum? Macab has many points of contact with gelsemium, chamomilla, and arsenic in nervous irritation and sleeplessness. But the nervousness of macab is of type of nervous exhaustion, where China is exhaustion from loss of fluids. And you interestingly, macab feels they are forsaken. No one is caring me. That is the main theme core of macab. Whole materiamedica, orphanage of remedy is macab. They feel I am forsaken. No one is loving me. No one is caring about me. That is the main feeling of macab. Magnesium and carbon, right? And all macab group of remedies have the sore smell, very offensive smell in stool, in urination, or in the body, which comes very close to room. In children prescription, macab helps very well. Sorinum, winter cough and summer diarrhea. And interestingly, how to confirm a sorinum patient in your clinic is even in very summer, every very hot summer, which is 45 degrees or 47 degrees, the patient comes with warm clothing covering the head. With the head, he covers with warm clothing. That is the key confirmatory of sorinum. You need to understand. That is the observation you need to understand whenever you want to prescribe some remedy. You need to have a keen observation on it. And in chronic ophthalmia cases, sorinum works well. Eye pathology. Perspiration, amel from all the sufferings is sorinum. And night hunger is sorinum again. So these are some key confirmatories I just added below this rubric. So you'll get an idea how to prescribe the remedies. Head pain, whether damp, wet, rainy aggravation, very windy aggravation, the remedy is basilinum. Head pain, headache, whether damp, wet, rainy amel is chamomilla. See here, head pain which is amal by this damp weather is chamomilla, and which is aggravation with this wet weather is basilinum. Now, what is the role of basilinum in homeopathy? Right? Actually I added some gist of remedies so that I can give you some clinical tips and how to prescribe. Right? Basilinum is the nosode where you find a family history of 5 generations or his mother, father, grandfather who having chest infections or tuberculosis family history with recurrent illnesses or in ringworm cases, you can prescribe basilinum. In fungal or ringworm cases, if the rings are separated, there are only two remedies comes to rescue, that is basilinum and sepia. If the rings of fungal infection are intersected, I can say below the other, if the 2 rings are touched, 3 rings are touched, that is telerium. Telerium works well in fungal infections in low potencies. And how you can confirm basilinum is one is family history, and the one recurrent illnesses you can confirm. And the basilinum patients have yellow teeth, yellow discoloration of teeth, and as well as the serrated teeth like Medorin. That are the key confirmatories of basilinum. So everyone know about chamomilla, right? So coming to next, mind, head pain, headache, violent sides, only on the sides, which aggravates on damp, wet weather, that is polygonum. So this remedy has a prominent action in rheumatism. Polygonum is a remedy where you can prescribe when your all the rheumatic remedies fails to act, either rustox or lacanenum or pulsatilla or phytoleca or rhododendron or stylingia. So whenever these remedies are not at all working, think of polygonum. With some female complaints, they have amenorrhea and metrorrhagia as well. And it is the remedy you can prescribe in intermediate fevers like China. Polygonum. If you open Clark, there is a line written that is rheumatism of whole body parts. That is polygonum. That is the key indication of polygonum. If due to this wet, damp weather, patient complains of tearing sensation of head, the remedies comes are calcarea, calicap, rhododendron, and rostox. Right. Now, calicap, right? Whenever, if you want to confirm calicap patient, if a patient comes into your clinic and says, doctor, now in my family, every day they will fight. Every day there is fight for bread and butter. There is fight for money. There is fight for some issues between my mother and father, brother and sister, neighbors, brother-in-law, son-in-laws. Every day these family fluctuations comes occur. So maybe due to this, I have developed all these complaints. The only remedy is calcarea. You can refer repertory. Quarrelsome from bread and butter is calcarea carb. Interesting, right? So this is the theme you need to understand in every remedies. So in calcarea carb, not only this, the key confirmatory of calcarea carb is never Welsing's pneumonia. If a patient comes and says, doctor, I have attacked with pneumonia, then after that, now all my complaints started. I'm getting backache, I'm getting headache, I'm getting rheumatic pains, I'm getting stomach pain. Everything is started after pneumonia, maybe. Can be calcarea carb. Never Welsing's pneumonia is calcarea carb. And the key confirmatory of calcarea carb, you just remember three. One is backache, sweating, and perspiration on the upper lip. These are the key confirmatory of calcarea carb. And whenever you have prescribed carboveg, listen this carefully. Whenever you have prescribed carboveg and carboveg is not at all helping, you can think of calicam, because in Fartak they have written carboveg has some quantity of calcarea carb. Right? Is it clear? Is everything is going clear? Yes, it is calicam, right? Is everything is going clear? Shall I continue? Yes, thank you. Now next, if there is pain in the temple region with wet damp aggravation, think of Nux Mosta. Pulsating pain, if there is lot of pulsating pain, thrombing sensation in this wet damp aggravation, think of Marxol. Forehead with bony pain aggravation in the evening with wet damp aggravation, the only remedy is Bovista. So key clinical tip of Bovista is whenever patient develops any skin complaints and have a history of hair dye application, think of Bovista. Think of Bovista. And there is one interesting symptom, urticaria on excitement is Bovista. Lot of edematous face, puffiness you can see in Bovista. And interestingly, Bovista patients, whatever they touch, even they touch scissors or any instruments, they get the imprint of that instruments on their hands. That is key confirmatory of Bovista. Right. Next, headache with neuralgic pain with wet damp aggravation, the remedy is medorinum. Right. Now, medorinum is the one of the very interesting remedy where I have used in almost all cases in this generation. Most of the people come in the category of medorinum because they are very passionate and high sexual desire you can see in medorinum. Along with that, they have lot of urinary tract infections. If there is a history of urinary tract infections and patient sleeps on abdomen, think of medorinum. And even in renal calculi, recurrent renal calculi, where you have prescribed beriberi, sarsaparilla, osimum, lyco, all the renal remedies you have prescribed, but nothing is helping. Think of medorinum. Recurrent renal calculi, medorinum. And medorinum patients are the patients you can identify very easily, where they come into your clinic and have more beard, extra hair growth. You can see very much of hair growth. You can see that is medorinum. And one of the clinical confirmatory of medorinum given by Boger is red warts. Wherever you find red warts is medorinum. And interestingly, during any pains, or especially in a renal collicular renal pains, they desires ice. During pains, they desire ice, that is medorinum. So this is the gist of medorinum. And they craves lot of seasonal fruits, mango, guava, cucumber, watermelon, greeny fruits, greeny vegetables. That is medorinum. They are very passionate at their work. At the same time, they are very much lazy as well. So these are the two sides you can understand in meadow. Yes, coming to next, nose. So nose obstruction is a very common in this rainy weather monsoon season, right? So what are the weather remedies coming to rescue are nose obstruction, stopped sensation, weather damp, wet in cold aggravation. The remedies are dulcamara, lemna manor, manganum aceticum. Now, when to use this lemna minor, dulcamara, and magnesticum, because all three have this obstruction, right? All three these remedies have nose obstruction with aggravation of wet damp weather. So when we can use these remedies. So coming into lemna minor, diminishes sensitiveness to wet weather, aggravated getting feet wet, asthma from nasal obstruction, worse in wet weather, like Sambucus again. So in lemna minor, you can see there is lot of nose blockages with polyps. With polyps, with nose blockages, and with sensitive to wet, damp weather. That is lemna minor. And here you see atrophic rhinitis with lot of crusty and discharges with lot of offensives. This is the key of lemna minor. Here you see putrefied taste in the mouth on rising in the morning, worse in damp weather with heavy rains. The only remedy in boric materiamedica where boric has mentioned heavy rains, that is lemna minor. Heavy rains. Keep this in mind. With no obstruction, think of lemna minor. Stringy sensation from the nostril to ear, snoring with obstruction of nose. Coming to dulcamara. Nose stuffs up when there is a cold rains. So this symptom you see here, whenever rain has started, the first affected is the nostril or the nose, the respiratory complaints. Then think of dulcamara. Every cold settle in the eyes, complaints caused by export to cold, damp, rainy weather or sudden change in the weather. Here you see patients living or working in damp, cold basements along with nitrum sulf, think of dulcamara. And whenever a patient mother says any newborn or infants and they develop these coryza, nose block or nose stuffles, only remedy dulcamara. Coryza of newborn is dulcamara. Rheumatic troubles induced by damp cold are aggravated by every cold change. That is dulcamara. Change of weather. We normally think of dulcamara, and dulcamara has prominent action on the respiratory as well as on the rheumatism. Remember this point, infants who suffer from coryza, dulcamara helps well. And interestingly, dulcamara is the remedy you can prescribe in warts as well. Sensitiveness to cold, damp runs through the Solanaceae family and is marked in belladonna and capsicum, but it is supreme in dulcamara, right? So this belongs to Solanaceae family in belladonna and capsicum. In capsicum, you can see a lot of burning sensation. That is a key confirmator of capsicum. And homesickness is capsicum, but it is supreme in dulcamara. This feature, among other, retains them all good antidotes to murk. And beretta is the complementary to dulcamara in worse from cold weather, especially in scrofulous children. That means who suffer with recurrent illnesses from the childhood. With eye pathology from catching cold, that is dulcamara. Here you see paralysis, wet after getting. So after this rainy weather, exposure to these rains, patient complains of paralysis. Think of these remedies: causticum, dulcamara, gelsemium, nux vosta, rustox. So causticum is more of right-sided paralysis, you can see, and causticum patients are more of sympathetic. If these paralysis occur in old age people and he complains of this paralysis, ask for involuntary urination is present or not. If there is an involuntary urination, go with causticum. If there are warts, also go with causticum. Very sympathetic nature, anxious for others, cares, worries for others is causticum. Dulcamara, as I said, gelsemium. In gelsemium, you can see a lot of drowsiness, dull, drowsy. Their muscles doesn't obey their will. That is the key confirmatory of gelsemium. Think of this. And nux vomica, we can see very anger, very irritable patient with constipation, with gastric problems, with this paralysis. If you get this symptom, think of nux vomica. Rustox with paralysis, they have lot of stiffness. All these paralytic symptoms will aggravated at night. Anxiety for children, you can see in Rustox patients, which is amel by motion. So this is how you need to confirm each remedy when you prescribe before to the patient. So my idea is not only learning the remedies, but how to prescribe and when to use is main important where we all fail. That is what my main theme, to understand the remedies along with the key confirmatory, when to prescribe, what question to be asked, what to be seen in causticum patient or what to be seen in Rustox patient. Now, how to use Rustox and dulcamara in rainy weather. In Rustox, it affects the joints. In dulcamara, it affects coryza, catarrh, and nose block. Interestingly, Rustox is better by continued motion. Dulcamara is better by continued motion. But whenever if you prescribe an acute base conditions, always observe the patient tongue. That will guide you to the remedy. Interestingly, we have done a case 2 days back where patient constitution is sepia and we prescribe sepia, patient is doing well. But in this between meanwhile of these 4 to 5 days, patient has developed severe rheumatism, which has Rustox-like modalities. We have prescribed Rustox, nothing helping. Then immediately I shifted to dulcamara and patient feels very better after 10 minutes of dosage. So in acutes, always observe tongue. So Rustox tongue is a red tip triangular, where dulcamara tongue is with lot of salivation. Is it clear? Shall I go to the next slide? Thank you. Thank you. Coming into ear infections. Ear infection remedies in wet damp weather. The remedies are calcarea carb, calcarea pos, dulcamara, magnum aceticum, nitrum sulf, nux mostra, petroleum, rhododendron, and silicia. If there is lot of stitching type of pain with the damp wet aggravation, think of nitrum sulf. And ear weather damp wet aggravation with cold, manganum and rhododendron. Feet getting wet after that they affect with ear infection, think of dulcamara. Now, ear pain. Ear pain with windy, cold and rain, chamomilla and nux vomica. Here you see, hearing impaired with damp weather. Due to this rainy weather, they complaints of hearing impaired. The one of the top remedy you can think of is calendula. And I will say one clinical tip. Whenever patient by birth or some other influences after the birth, they have stopped hearing. The hearing is lost. The hearing is impaired. The two remedies come to your rescue. Please note it down. One is calendula, another one is thiocyanine. These two remedies will rescue in low potencies. Calendula, thiocyanine. But here you see the wet aggravation. The remedies are calendula, dulcamara, calimur, magnum, merc, pulsatilla, and silicia. Now, manganum. This is one of the top remedy in ear infections from wet damp weather aggravation. Deafness in damp weather. Deafness which is amel by blowing nose. Think of this remedy manganum aceticum in ear infections with wet damp weather. First remedy you can think of this remedy. This works well. And Boric has written deafness in damp weather. Deafness amel from blowing nose. Dry, obstructed, chronic catarrh, bleeding, dryness, worse in cold damp weather. Sore pains in the whole body like baptisha, like bellispi. Sore pains in the whole body. And manganum, one of the key conformity of manganum, they suffer with chronic eczema with amenorrhea. This is manganum. Coming to rhododendron. Very sensitive to windy or stormy wet weather. Rheumatism of hot weather. Interesting, right? Here you see rhododendron is sensitive to windy, stormy, wet weather. Along with that, rhododendron is the remedy where they have summer rheumatism. Rheumatism of hot weather, that is rhododendron. And rhododendron is the remedy in hydrocele, which is congenital. Congenital hydrocele cases. When no remedy is working, think of rhododendron. Along with that, pulsatilla, abrotinum, bryonia, and graphitis. So pulsatilla child is very mild kind of nature you can think. Abrotinum is extremely violent, opposite to pulsatilla. Abrotinum is the remedy where the child is very violent, very unhumored, destructive you can think of. In such cases, abrotinum works well. And abrotinum is the remedy in geriatric cases in old people who complains with rheumatism along with the complaints of constipation. That is abrotinum. Bryonia, bry is equal to dry. All mucous members are dryness. You can think of bryonia. Fear of being poverty is bryonia. They want their basic needs to be covered. They're always in that thought of how I can. That is the fear of poverty you can see in bryonia. Graphitis, right? Graphitis is a remedy in this hydrocele congenital, and you can think of graphitis with skin eruptions where the skin have the discharge which is very honey like sticky discharges is graphitis. And even blackish discoloration with skin complaints, graphitis, because doctrine of signature of graphitis is blackish discoloration. And graphitis patient now how they behave in the patient now, very smallest trifles aggravates that is graphitis. For example, a graphitis lady calls to the husband and says, husband, ये हुआ वो ऐसा सोच रहा वो बोला ये बोला, this girl said like this neighbor is saying this boy is saying this, or papa is saying this is graphitis. Very slightest trifles aggravates is graphitis. Always complain something is graphitis. Gouty with rheumatism. Patak has given only single rubric. Gouty with rheumatism is rhododendron. Difficult hearing with wheezing and ringing in ears. Sensation as if of warm. Tinnitus with vertigo is rhododendron. Fear of thunder in nervous persons. Fear of thunders in nervous persons. And if you get patient, you need to confirm phosphorus. Phosphorus has fear of thunderstorms. Carcinosin sepia has law for thunderstorms. These you remember. If they have fear of thunderstorm, phosphorus along with rhododendron. If they love for thunderstorms, carcinosin and sepia. And interestingly, rhododendron cannot sleep unless legs are crossed. Here you can see how the legs are crossed. That is the sleep position of rhododendron. So many people know here, I always ask for sleep position as well. That will give you an indicated remedy when it is present. So even every minute information is important from the patient. Don't neglect it. That will guide you to some remedy for sure. Headache with thunderstorm during, that is rhododendron. Coming to nitrum sulf, it is nothing but more of hydrogenide constitution with liver complaints. Complaints due to living in damp, rainy weather, water in any form. So that's why nitrum sulf is one of the top remedy in hydrogenide constitution and having liver pathology. Clinically, it has been found a valuable remedy for spinal meningitis in chronic gout as well. And nitrum sulf for the patients, they cannot eat fish. fruits, juicy vegetables like tomatoes. Main action of asthma and bile ducts. So it is one of the frequently used remedy for gallstones. I will say you one clinical tip. Note it down. If gallstone is very large, only one gallstone which is very large, think of jugular cinerea. Remedy jugular cinerea. One gallstone which is very large, that is jugular cinerea. And another clinical tip, just note it down. If you get a patient who is having mild, having pulsatilla like constitution with gallstones, the remedy is thalapsy. Pulsatilla like constitution having pathology of gallstones, the remedy is thalapsy. Itching of toes in the evening when undressing, like oleander, again undressing aggravation skin complaints, nitram sulf and oleander as well. Now coming to chills during cold damp weather. Chill weather, cold damp wetting, the remedies are ammonium carb, arenia diadema, calcarea carb, dull camera, ferrum, nitram sulf, nux mosta and rustox. Chills during cold damp weather. Whenever you get a patient, chills developed after rains, and patient says, after rains, I started getting fever with constant chills. The chills, very constant chills. Any remedy is not at all helping. No remedy is not at all helping. Even the antibiotics. Think of arenia diadema in low potency. Arenia diadema, very constant chills. In aggravation with the rainy season, with monsoon, Arenia diadema is a hydrogenide constitution, feels cold to be every bone, not relieved by everything. This is the key. That's why you see the core of Arenia diadema is chills. Every bone of the body feels very cold, not at all relieved by anything. Even arena diadema patients, if they sit under fire or under any stove or under any heat, they cannot relieve at all. That constant chills you can see in this arena diadema patient. Constant chills, constant chills. I will answer all the questions. Please keep noted down your questions, and I'll see in the chat box later on. I will answer all your questions. See here, coldness not relieved by any external heat. That is arena diadema. Coming to fever, dengue fever with hemorrhagic, arsenic, china, sulfuric acid, ferrum, and hemimillus. Dengue fever, Euphrasia perforatum, gels, aconite, bryonia, and rustox. Fever with wet getting after. The two remedies, that is rustox and pulsatilla. And interestingly, when there is high fever, which is 101, 102, 103, not at all getting down, even with antibiotics, nothing is helping. You have given rustox, or you have given arts, or you have given gels. There is nothing helping from homeopathy point of view also. Think of remedy pyrogenum, 1 ml with water dose repetition. Check the temperature before you give the medicine, and check the temperature after 4 doses. You check the medicine. There will be slight relief in temperature, which comes very down. Pyrogenum works very well in emergency ICU cases where patient is admitted and fever is not at all getting down. With they have given antibiotics, but patient is not at all relieving. Think of pyrogenum. Toothache and rain. Pain, toothache, weather, damp wet aggravation, allium cepa, arera diadema, borax, calcarea, dull camera, murk, nitram sulf, nux mosta, phosphorus, rhododendron, rustox, silicia. So almost most of the remedies will be repeated here because these are the core or cracks of the remedies where they have this wet damp aggravation or this monsoon weather damp aggravations you can see in the almost all the remedies. The pathology is different, but the remedies are same. You need to understand what to be indicated, when to be indicated this remedy. Pain, toothache, night aggravation, air in damp wet weather. Arena diadema, murk and nux mosta. Pain, working in damp wet places. Arsenic, calcarea carb, dull camera, rustox. If there is lot of tearing pain, nux mosta and phosphorus. If there is lot of jerking pain, it is phosphorus. Weeping pain is borax. And Naxmostata comes very close to gelsemium with drowsiness, dullness, sleeplessness, comes very close to cannabis indica family, right? And as I said, phosphorus, fear of thunderstorms, you need to ask whenever you need to confirm patient of phosphorus, and ask for desires for ice creams, desire for cold drinks, and ask for sensitive to flower smelling, sensitive to tobacco smell is phosphorus. And the constitution of phosphorus is very tall, thin guy, that is phosphorus. And now you think of, see, whenever you get a patient who is very sympathetic, very helping nature, anxious for others, the three remedies comes to your rescue is phosphorus, causticum, nitric acid. Now, how you can differentiate these remedies? Phosphorus. Phosphorus feels the anxious of others. Like, for example, if I am suffering from some anxious that I may fail tomorrow in this exam, now phosphorus will feel the anxious what I am suffering with. That is phosphorus, sympathetic, very sympathetic. And in Kent, he has given genuine affectionate. Only one remedy is phosphorus. Causticum has that anxious for others, but causticum never feels the anxious of others. Right? And how to confirm causticum whenever patient comes to your clinic, having this sympathetic nature, cared worries for others. Just you ask one thing. That is, suppose if your husband or your son or your daughter who is away from your home and they are in the journey, now the time is around 10 o'clock, 11 o'clock. Will you sleep? No, no, until they come, I don't sleep. That is the anxious, uncared, worried for others. You can think of causticum. With involuntary urination, you can see with aversion to sweets is causticum. What you can see. So these are key confirmatories. And other remedy comes very close to this is cocculus indicus, but you can differentiate cocculus indicus with motion sickness. Phosphorus, causticum, nitric acid doesn't have this motion sickness that marked, but cocculus is highly marked with motion sickness along with sympathetic nature, cared worries, anxiety for others, night watching for others. That is cocculus. Coming to face and rain, pain, weather, damp, wet aggravation, calcarea pos, murk, nitrum sulf, rhododendron, rostox, sepia, and silicia. If there is jaw pain with wet damp weather, the remedy is ambrose. I will share that remedy in the below PPTs. Hearing pain with wet weather, damp aggravation, murk, rhododendron, and rostox. This rubric you see. Fungal growths in the lower jaw with wet damp aggravation is tuja. And interestingly, cancer of this lower jaw with wet damp aggravation is also tuja. Now, tuja, this is one of the polycrust, right? Now, how you can confirm patient of tuja? One, desire for raw onions. They have both extremities, desire for raw onions and aversion for raw onions as well. Tuja. Desire for tea. Tuja. Very, very religious affections, religious mania for tuja. Like you can say, how you just ask the cross question to the patient. For how long you have a daily pray? Yes, I have daily pray. How many hours or how many minutes? I at least I have for 1 hour or 1.5 hours. Can be tuja. And you can ask, suppose if you are suffering with some problem, do you go for any yatras of this God religious ones? No, no, pakka I will go, doctor. I must go there. Then only I feel better. That is tuja. Very religious mania. With desire for raw onions, desire for tea, with warts on the body. And there are so much of fragility you can see. Fragility, delusion fragile, delusion brittle he is, delusion body brittle he is tuja. How you can confirm this in the physical sphere as well? Do you eat fast food outside? Do you eat any fast food center? No, no, doctor. I never eat. I never touch that food only now because I think my body doesn't suffer. If I eat this gobi manchuria, if I eat this fried rice now, immediately I start complaints of vomiting, nausea, stomach pain, abdomen pain. Na. So I avoid that. That is tuja. They feel they are so much of brittle, delusion, fragility. Even arsenic comes very close. But in arsenic, they have lot of hypochondriacal fears with the same spear of not eating outside. Tuja have delusion that their body is brittle, their body cannot take that food. They may develop some pathological conditions. That is Tuja. And interestingly, we are coming up with many polycross remedy sessions with very clear explanation in upcoming webinars. Eruptions, papular with wet, cold, damp, wet aggravation is sepia. And sepia is washerwoman's remedy, everyone knows. And in sepia, you can see lot of indifferences. Indifference to loved ones, you can see. Independent lady, loves for bathing. To confirm sepia, ask how many minutes you take for bathing. Do you take regularly bathing? Yes, doctor, I take daily 3 or 4 times. And if I go now, I don't come for half an hour at all. That is sepia, love for bathing with other confirmatory symptoms. With other confirmatory symptoms. Desires fish is sepia. Face eruptions, acne. If there is acne with this wet, cold aggravation, the remedy is belly spee. And remember, if there is painless acne, that is calibrom. If it is painful acne, Eugenia gembosa. These two remedies will work wonders. Ask if patient comes with acne. If it is painless, that is calibrom. And if it is painful, it is Eugenia gembosa. And interestingly, whenever patient says after using of the remedies or some remedies and the scar marks is not at all going, you can think of calibrom. Scar marks removal, calibrom is the remedy in acne cases. And in scar tissue removal, that is tiosinum. Is it clear? Everything is going well. Shall I go forward? Painful acne is calibrom. Yes, yes. Thank you. Coming to cough and rain. Cough, wetting, get aggravation from the feet. Barretta cup, Nux mosta, and tuberculinum. And tuberculinum is the remedy where patients suffer from recurrent childhood illnesses with all respiratory complaints, which occurs very recurrent year by year, can be tuberculinum. And tuberculinum patients are very destructive, disobedient. Beretta cup is so much of shy, timidity you can see, developmental delay you can see in Beretta cup. That is Beretta cup. Hacking cough is calcarea pus, and here you see the clinical tip of calcarea pus. Whenever you see a child of the CP child, they are like prosperous constitution, long nails, long extremities with very thin body, emaciated. And CP patients, you confirm one thing, they doesn't like eating rice. Doesn't like eating rice. Normal food, regular food, they doesn't want. They always want change. They always want change. That is CP child. And all the CP patients desire for smoked food, smoked wheat, tandooris, pizzas. That is CP. In synthesis, if you refer general food and drinks, rice aversion to only single remedy CP. Only single remedy CP. Rattling cough is ipecac with lot of vomiting you can see. Cough with vomiting, whenever cough ends in vomiting and patient says, no doctor, when I'm about to cough, then there is a nauseating feeling. Always think of ipecac. Always think of ipecac. Even ipecac is a remedy for morning sickness in pregnant ladies along with syncorpus. Syncorpus racemosa. But ipecac is always top. Ipecac is always top. Cough in wet room is bryonia. Wheezing cough is iodum. And iodum also see there are a lot of emaciation you can see, very much atrophy of glands you can see iodum, desires for salt with this wheezing cough is iodum. Cough whether damp wet amyle. Wet amyle is heparsulf. And heparsulf is the remedy where there's so much of oversensitiveness, all the external impressions. Very, very much oversensitive to external impressions is heparsulf. And heparsulf is the remedy, they want to set the things on fire. That is heparsulf. In carbuncles, boils, where there is lot of pus, think of this heparsulf, silicia, terentula accubans as well. That comes very close in such clinical conditions. Cough, vallets, cellulars, damp wet air of aggravation, bryonia, sepia, and antium tot. Tell the remedy. If antium tot fails and patient complains of these, patient is very old and having this chronic bronchiectasis and this cough is aggravated at damp wet aggravation, you have prescribed antium tot and they have symptoms of this wheezing, everything which is like antium tot, but not at all working. Patient is old. What remedy you prescribe? Antium tot fails. Text in the chat box. Yes, no. The remedy is ammoniacum. Ammoniacum. Remember this remedy. Ammoniacum is old age antium taught in wet damp air aggravation. I think there is one rubric, generals, old people with bronchiectasis which aggravates with wet damp. It was given by Fatak, I think. The remedy is ammoniacum. You can refer in Boric, I think. Boric or Clark. And the other remedy is hypoxenum. That also comes very close to antium tart. Old age of antium tart is hypoxenum along with that ammoniacum. Chest and rain with lot of dropsy with chest affections with very damp weather is dull camera. As I said, Kalikab has this respiratory complaints very much marked with lot of heaviness in the chest and inflammation of bronchiectasis with this weather damp is dull camera. Nodules mammale is phytoleca. And here you see there are three remedies which comes very close in hard breast tumors of mammae. Phytoleca, conium, philandrium. Philandrium, Phytoleca, conium, philandrium. To confirm conium, patient must be having old age, old labor, old maid, and having concomitant of vertigo and having concomitant of earwax is conium. Phytoleca with electric-like pains you can see. Next, lot of oppression you can see with this wet damp weather, Dulcamara, KC and nitrum sulf. Lot of windy with damp wet weather, Rustox and Ranunculus bulbosa. Sore bruised feeling in the chest, copper, Ranunculus bulbosa and Rustox. Intercostal rheumatism, think of Ranunculus bulbosa. I'm about to say intercostal rheumatism. Whenever you get a case who having intercostal rheumatism, the only remedy comes to your rescue is Ranunculus bulbosa. And even in skin affections, that is herpes zoster with this wet damp aggravation or herpes zoster, Ranunculus bulbosa works well. Tuberculosis of lungs, TB of lungs, which is aggravated with wet damp weather, is Dulcamara. Abdomen, inflammation from wet weather is gels. Cramping pain is Dulcamara and Magnum. Pain exactly at umbilical region. This you see. Whenever patient complains, no, doctor, this rainy weather, I get exactly at umbilical region. The pain is very exact at umbilical region. That is aggravated only this monsoon season. Dulcamara, single remedy Dulcamara. The location is important. Pain, weather, wet aggravation, Dulcamara, Magnum, nitrum sulf, Dioscorea. And Dioscorea is the remedy, bending backward. Amel bending backward is Dioscorea. Coming to rectum and rain. Diarrhea while standing, sitting in damp wet aggravation, Dulcamara and Rostox. Dysentery with this weather aggravation, only remedy capsicum. Dysentery only weathery with weather aggravation is capsicum. With lot of burning you can see. Flatus aggravation in damp wet weather, aloes. Diarrhea amel in this wet damp weather, aluminum and asarum. Coming to voice now. Lot of hoarseness after getting wet, Rustox. Hoarseness in wet damp wet aggravation, Carbovage, Dulcamara, Calibi, Romex and Cilicia. Now, Calibi. So whenever if a patient comes to you who are having this cough with expectoration which is very sticky and patient says, now doctor, even I pour water now, that discharge is not at all going. I need to keep flash or I need to pour at least 3 or 4 mugs of water, then only that discharge goes. The sticky discharge is Calibi. And interestingly, tell the remedy, these cough sticky discharges, you have given Calibi, but Calibi is not helping. What remedy comes to your rescue? Yes, hydrostis. If Calibi fails, where you have these sticky discharges, the remedy is hydrostis. Rumex, right? Interesting complaint of Rumex is whenever, if the head touches the pillow, then they start coughing. That is Rumex. Night aggravation cough Immediately head touches the pillow, then they start coughing. That is Rumex. Silesia, everyone knows about silesia, like fear of examination, fear of stage fear, very obstinate, perspiration on the soles and palms. So these are some key confirmatories of silesia. Husky voice, think of tuberculinum. Voice last in wet weather, Baretta cup, Kalibai, Carbovage, Rumex, and silesia. Tell the remedy, voice is lost after anger. Voice lost after anger. Yes, staff is good. And other interesting, causticum works very well in loss of voice. Think of causticum as well. Throat pain, weather aggravation, calcaria, dull and hepar, raw sensation. In the throat, there is a lot of raw sensation. Raw sensation, that is phosphorus. Sore pain, calcaria, dull, hepar, rustox. Inflammation of sore throat, calibi and merc. Coming to skin and rain, as I said, if there is herpes zoster with this wet damp aggravation, that is ranunculus bulbosa. And this you can see the picture, this is herpes zoster. If there is erysipelas with damp wet aggravation, that is rustox. Urticaria, interesting, right? Chronic urticaria, you have given many remedies like urticaria urens or bovista, etc. But nothing is helping. Think of nitromune. In chronic urticaria cases, nitromune works well. And rustox, as I said, right? And whenever you have prescribed rustox to this erysipelas or any skin infections where the patient is exactly rustox, the skin complex is matching to rustox, but rustox is not helping. But rustox is not helping. What remedy you can think of? Text in the chat box. Yes. Rus venom, right answer. Rus venatum. Rustox is a prominent remedy in skin pathology. Where you have prescribed rustox but nothing is helping, think of Rus venatum. And I will give you some information which I learned from my gurus, right? See, whenever you have prescribed a remedy which is rustox, that is ranunculus family, and it has helped only partial, like it has helped 30% or 40%. Why you jump to the other remedies which belongs to some other family, Solanaceae, Loganaceae, etc. Never. You have prescribed rustox based on constitution. That means the patient will belongings to this ranunculaceae family, but some other remedy. That you need to understand. Before jumping into some other remedies or some other families, you just cross check with the same family. You will find when you prescribe based on the constitutional medicine, there itself in the same family you will find the patient symptoms. And other interesting thing is, whenever you get any skin complaints, itching, eruptions, etc., if it is amail by hot water, the remedy is rus venom. If it is amail by cold water, the remedy is figopyrum. These two keep in mind. Skin complaints, amail by cold, figopyrum. Any skin complaints, itching, eruptions, amail by hot water is rus venatum. Is it clear? So whenever you get any skin complaints in your clinic, or ask the patient to try cold water amail, warm water amail, that will give you some clinical indications. That will help actually in selecting the right remedy. Coming to urine, dysuria, wet becoming, allium cepa, dulcamera, pulsatilla, sarsaparilla, and sulfur. Dysuria, feet becoming wet, allium cepa and dulcamera. And allium cepa is a remedy you can prescribe in symmetrical warts along with syphilinum. If you find symmetrical warts, that means in the same line the warts are there. Think of these two remedies, allium cepa and syphilinum. You can refer Allens. And allium cepa is the remedy where patient says, doctor, na, yesterday, 1 week before now, I bought new shoes. And after wearing that new shoes now, my shoe bite has occurred. There are complaints of shoe bite, skin eruptions. The remedy is allium cepa. In shoe bite cases, think of allium cepa in low potency. Refer Allens. You will understand it. Dysuria, feet becoming wet, allium cepa, dull camera. Urination, frequent wet from senescence auris. And this remedy helps in amenorrhea in young girls. You have prescribed a lot of remedies, but still the patient complains of this not getting menses. Give senescence auris in low potency, 30, frequent repetition for 2 or 3 days. Scanty urine, colchicum. And here, colchicum, right? Colchicum is a remedy for small joint affections like gouty rheumatism, small joint affections. There are other remedy that is Actia spicata. If patient is male with the small joint affection of rheumatics, think of Actia spicata. If the patient is female, think of colchicum. This is clinical confirmatory. A retention of urine, feet wet getting, allium cepa and rostox. Bone pains in wet weather. If there is bone pains which is on exactly on the peristonium, that is Merck, rhododendron and stellingia. Merck, oily perspiration you can see in Moxol, cold, clammy, sweat on legs at night. Patient is very sensitive to cold, bony pains, deep or near the surface, worse at night, must get up, walk about, trembling in the limbs you can see, especially in the hands. Parkinson's disease, right? Tell me the remedy. Where patient have lot of trembling, even patient cannot hold a pen or cannot hold a glass of water as well. And you have prescribed lot of remedies, nothing is working. Tell the rare remedy which helps in these trembling cases. Text in the chat box soon. Yes, Lolium temulatum. Right answer by Kuldeep Doctor. Good. Lolium temulatum, rephoboric. Rephoboric. Moxol, moist tongue with salivation and intense thirst. Profuse perspiration without relief. Lot of offensiveness you can see. Desires bread, butter, aversion to sweets. Chronic and acute otitis media. Stellingia. And here you see, whenever you get a rheumatic complaints where they don't have any exact modalities of rustox, bryonia, or phytoleca, or pulsatilla, or lacanum, there is no modalities, and you have prescribed some remedies, nothing is helping. Think of this remedy, Stellingia. It helps very well in rheumatism. Extreme torture from bony pains and peristonial affections, especially in the tibia. Chronic peristonial rheumatism, enlarged cervical glands with lot of sadness, that is melancholic like constitution, temperament, liver troubles and constipation. Rheumatism. Warts due to damp wet weather aggravation is dull. Ulcers painful is sorinum. Trembling in hands, dull camera. Paralysis, as I said, causticum, dull, Naxoster, Rostox. Sciatica, damp weather aggravation. Dull camera, Rostox, Phytolica, Gnaphalum. To prescribe Gnaphalum in sciatica cases, ask for numbness. If numbness is present in sciatica cases, the first remedy is Gnaphalum. Pain, wet, getting, dull camera, Rostox. Rainy weather, Amel. The only two remedies, Naxomica and Causticum. Stiffness in the wrist is Rostox. Stiffness in the cervical is Belladonna. Pain in the wrist is Rhododendron. Inflammation of joints is nitrum sulf. Inflammation of toes is nitric acid. Lumbago with getting feet wet after dull camera. Back pain is calcarea, dull camera and Rostox. So coming into some indications of these remedies, I'll go very fast. Rustox is highly beneficial for joint and muscle pains that are worse in wet, rainy weather. Clinically, it is used for conditions like arthritis, muscle sprains, skin eruptions that are aggravated by dampness. Patient often reports relief from symptoms which continued movement and warmth. It is also effective for treating herpes, skin rashes that are worse in rainy weather. And you, to confirm Rustox, you ask patient at the night. That is exactly after 12 or 1 or 2. He feel anxious about his health, anxiety about his health. That is exactly after midnight. And he calls to some of his friend or close relative and speaks about his complaints. What my complaints will get relief or not. I am suffering with this problem. Is it okay? Fine. Is it any big issue? So he feels anxious. That is which is exactly aggravated after midnight. Refer Fatak for this. That is Rustox. And anxiety for his own children is Rustox. Only single remedy Rustox. Anxiety for his own children. Dull camera. Dull camera is indicated for ailments triggered by exposure to cold, damp weather. Clinically, it is effective for respiratory issues such as cold, coughs, bronchitis that develop after exposure to wet conditions. It also helps with rheumatic conditions, skin eruptions, digestive disturbances triggered by damp weather changes. Dull camera is especially useful for patients whose symptoms worse with the onset of rainy weather. An interesting keynote of dull is every part is icy cold. Icy coldness of paralyzed parts and as especially the pain parts. That is icy coldness. Like ledum. Like ledum. If you touch ledum patient where there is a pain or where there is infection, that part is very cold. To prescribe ledum, that is the clinical indication. Ammon carb is suitably for respiratory conditions that worsen in damp wet weather, such as cold, coughs, bronchitis. Clinically, it helps patients who are sensitive to cold and wet conditions. It is particularly effective for elder individuals with chronic bronchitis or those with weak constitutions. The remedy also alleviates symptoms of nasal congestion, that is epistaxis in the early morning, nosebleed, and catarrh that are more common during rainy season. Lot of obesity you can see. This is the remedy Blata, one of the top prominent remedy for asthma. Asthma with lot of perspiration you can see in this Blata orientalis. Asthma is one of the prime remedy. Blata orientalis is primarily used for respiratory issues like asthma, particularly when symptoms are worse in damp rainy weather. Clinically, it helps to reduce the frequency and severity of asthmatic attacks triggered by wet conditions. Patients often experience relief from wheezing, difficulty in breathing, chest congestion during rainy season. Bellispi is effective for muscle and joint pains exacerbated by cold wet weather. Clinically, it is used for deep muscle injuries, bruise, soreness from overexertion, which can be more troublesome in damp conditions. It helps to reduce inflammation, promotes healing of soft tissues that is affected and by the increased moisture in the rainy season. Causticum, very much rheumatic with neurological complaints. Patient express lot of stiffness, sensation of heat in the affected areas with respiratory illness like hoarseness, as I said, chronic cough with damp weather condition. Sambucus, nostrils black, snuffles of the children with mouth breathing. That is Sambucus, especially in the night. That is during rainy season, you can see with lot of flu symptoms. Rhododendron with lot of neurological complaints and aggravated by stromy. As I said, stromy. That is the main key. With joint pain, stiffness, neuralgia. This improves with warmth and rest. Interestingly, as I said, rheumatism in the hot weather, and it has some relief with warmth as well. Contradictory of rhododendron. And you can use in orchitis cases, in hydrocele as well. Ossimum santum. This is tulasi actually. In a common name, you can think of tulasi. So this helps a lot and lot in these respiratory complaints. How many grandmas, grandfathers, they use tulsi water to drink every morning in such rainy season? That is immune booster actually. Ossimum santum, known for its immune boosting properties, can help prevent cold, flu during rainy season. Clinically, it supports the immune system, reduces the severity of respiratory infections. It is also beneficial in managing the stress and improving overall vitality during periods and increased humidity. Ipecac, as I said, with lot of nauseating feeling, lot of nausea feeling with any symptom, there is nausea and vomiting. That is Ipecac. Sepia, useful for women experiencing hormonal imbalances aggravated by rainy weather. And interestingly, if patient says, doctor, now after this rainy season, now my menses are irregular. Before that, it is regular every day. The remedy is pulsatilla. Getting feet wet, amenorrhea. Pulsatilla is the remedy. Only pulsatilla will help for sure. And other interesting remedy, polypus, is indicated in conditions of exacerbated damp weather. Clinically, it is used in treating rheumatism and neuralgic pains that are worse in rainy season. And this is also one of the remedy with rheumatic pains and with intermediate fevers as well. And we are coming up with the course on polycrust. 30 polycrust remedies will be covered. And in this session, we will concentrating on understanding of repertory with materiamedica, understanding the single remedy rubrics of each remedies, the delusion patterns. So mainly to understand a remedy, we need to go through the deepest core of delusion. That is the prominent. When you understand the pattern of the delusion of each remedy, that will be interlinked with all the physical and mental levels. We are much more concentrated understanding the core of the remedies. And this session or this course will help you to identify very easily who the patient is. And this 30 polycrust remedies will help in your clinic very much beneficial. And this work is under process. We are working on it, collecting lot of matter from different good authorized books, good clinical experiences with lot of cases from different masters and from us and from some other clinicians. We are collecting it and we are working together it. Will be who are interested, just DM us for the price, and we'll announce the dates very soon of what remedies to be we are covering with. We will cover with 50 remedies, 15 in different sessions, and each session will be around 1 hour 30 minutes on all the lesion patterns with single rubrics, repertory, materiamedica. The corest of core we are about to learn and how to identify the constitution. And whoever people who have not there in our groups, Learn Homeopathy WhatsApp group, Instagram and Telegram, please scan this and follow us. We'll be sharing a lot of information based on it. And our main motto is to promote the classical homeopathy, not using any mother teachers or any biochemics. And today I have done this session is because of my gurus, where I learned from a lot of gurus, Dr. Jiti Sharma sir, Dr. Gaurang. So they are my limelight to this, and the same limelight I need to share to all this upcoming homeopaths. Follow the right footsteps, that will guide you with lot of information, because we are seeing lot of success in our cases only because when we follow the right gurus and right path. Thank you. And the main interesting who all I have attended, like around 70 to 80 people have attended. Please do share your feedback in WhatsApp. Please share your feedback. Just pay for at least 1 or 2 minutes, and each and every person feedback will guide us to do some more free sessions. We are coming with some free sessions as well. And through some clinical books which I read, I'm doing the PPTs as well. So we are coming with that as well. Please do share your feedback. That will help us a lot and a lot. Thank you who have joined this session. Thank you so much. Yes, phygopyrum. Skin complaints are made by cold water medicine is phygopyrum. Thank you. Please do share your feedback.